Hi, everyone. Welcome. My name is Julie Dugan. I'm a program development specialist in the Office of Faculty, International Engagement, and International Affairs. And thank you all for coming. This is a really wonderful opportunity. First, if you didn't know, this is the Global Health Internship in Oaxaca. So if you're not here to hear about that, you can feel free to go, but I hope that you are here. And we're going to get started. Okay, we have what looks like a fairly long agenda, but we will make sure get you all the important information about this program with our first thing hearing from our wonderful AVP, Dr. Cristina Alfaro.
Thank you. Thank you, and welcome to all of you that are on Zoom. And for those of you that are here today, I hope that you will grab some snacks because we bought them for you. We are super excited about offering this opportunity to you. So we're very happy that you're here today. We've got a chance to talk to the first two that came in, so we know a little bit about it. We'd love to hear about who you are and why you want to participate in this program. But this program is a very, very unique program. In fact, all of us that are helping to plan this program say, like, we want to go. We want to be part of this. So what you're going to find out today is a lot of details about what the program is about, what you are expected to learn, as well as the support that we have for you. Because this is not a cheap program. This is a very well thought out, very well put together program, and this is a presidential initiative. So what does that mean? All of you know who the president is, right? Dr. Roberto. She actually started this program when she was at Davis, UC Davis, and so it's very successful. It still continues to be over there. That's when you know a program is successful, is when the person that started it leaves and it's still going on. So her plan was for us to start it here at San Diego State. We started the first cohort last year. It was a very small cohort, and this year we're hoping to take a larger cohort. And already by the looks of it, it's going to be. We were recruited in the Imperial Valley a couple of days ago, so we're also getting some interested students from that particular area. The reason that we're starting these orientations early is because the timeline is really, really critical. That if you're going to go, you have to start planning desde ahorita, as of now, right? So what you're going to be hearing today is how you can plan, how you can carve it out, and then also the financial support that we're going to be able to give you so that you can take advantage of this experience, because we have the associated students. There's a fund that is directly been set aside for students that want to participate in this program. So you'll hear more about that, right? But anyway, thank you so much. I hope that you will, have a lot of questions so that we can help you plan your Oaxaca internship. Thank you. Oh yes, thank you so much. In fact, I was just doing a PowerPoint. So another very unique aspect about this program that no other program has is that we offer what we call the global, it's a university seal of biliteracy and cultural competence. How many of you are bilingual here? Okay. Are you bilingual? No, okay. So for those of you that are bilingual, bilingualism is something that we really value here at San Diego State and, just in our society, right? Especially being so close to the border. So those of you that participate, as you know, you're going to have a Spanish course and you'll be immersed in Spanish. So when you return, you will have an opportunity to apply for this seal of biliteracy. So in other words, you will be able to graduate with your degree and a global seal of biliteracy. It's a badge and a certificate. So when you go for employment or anything that you do, beyond this, that you will have this evidence of your bilingualism, because the exam, it covers the reading, the writing, the listening, and the speaking. So, because as you all know, there are so many different levels of bilingualism. Some people can speak it, but they can't write it, or some people will speak it more or less. But this program is to really highlight this proficiency so that you'll be more employable, or just kind of value, the linguistic ability that you bring. So that's also part of this program. Okay. All right, so back to you, Julie.
Yes. Okay. So unclickable.
I think you have to just, you're not in presentation mode, so you have to click the arrow.
Apologies, I'm technologically inept right now. I'm going to talk a little bit about some of the very important details before I hand it over to our on-the-ground partner, Carolina. For those of you who do not know yet, this is a 6-week program. It's from May 20th to July 1st of next summer. And it's going to be a 3-unit course that is accompanying your internship rotations. And of course, it is going to be held in Oaxaca, Mexico. And if you weren't excited already seeing these photos, I hope the beautiful colors, the wonderful landscapes, the amazing food, hopefully this is piquing your interest a little bit more. There are a couple requirements or prerequisites. So juniors and seniors are typically given priority, but graduate students are more than welcome to participate in the program. And for some of you master students who are doing public health, I know there's a dual Latin American studies, public health. Is anyone in that program? No, that's okay. This is still a wonderful program for graduate students as well. We want you to have at least a little bit of background in science and human anatomy so that you understand what's happening in the rotations. And our recommended minimum Spanish is an advanced beginner, because then you'll be able to engage more with the physicians and the nurses that you'll be working with and really get a lot more out of the program. And a minimum GPA of 2.0 is required. And lastly, your rotations in your clinics and NGOs are going to be about 4 to 6 hours. So knowing that you might be on your feet for a very long period of time, just being aware of that as well. And now it's my honor to introduce our wonderful on-site partner, Carolina. She has been working with us since we started this program last year, and she's going to give you a lot more information and the nitty-gritty details about what your days are going to look like, what homestays are going to be like, and just your life in Oaxaca. And I will stop sharing so that Carolina can share. And Carolina, I will also give you the ability to share, because I don't think that you currently have that.
Perfect. Thank you so much, Julie. And as I was joining the Zoom call, what a fantastic idea to start all of our meetings with a little bit of music or just every Zoom call. So Julie, next time that we meet in Zoom, we can do that. So hi, everybody. So nice to be here. Well, the ones that I'm seeing on screen, so nice to see some faces. The ones that are joining in from Zoom, if you want to turn on the camera, it's always nice to see who's on the other side of the name. But just so you know, my name is Carla Molaños. I'm Director of Programs and Safety for CFHI. And today we're going to go through a little bit of information of what is CFHI and what we do, because it's important that you know the partner organization that is leading this program in Oaxaca. But also, like Julie mentioned, I'm going to give you an overview what to expect of this internship that we're really excited to be offering again next year. We have a fantastic partnership with San Diego State, so very excited to be here. And feel free to either write your questions in the chat, the ones that are joining Zoom, or at the end I will, of course, leave time for questions. So let me share my screen. 1 second. Okay. Okay, so CFHI, Child Family Health International is the full name, but we all know it by CFHI, has been working in the field of global health education for 30 years. So this speaks a lot of what we do, how we do it, and what it means in the field of experiential learning, right? So we have right now programs in 10 different countries that I'll show you the map right now. So we have in Mexico, Costa Rica, that's where I'm based, Ecuador, in Bolivia, in Ghana, and Argentina, Uganda, South Africa, India, Philippines, and in some of the sites we have more, in some of the countries we have more than one site. And we're going to focus today in Oaxaca, Mexico here. So very excited about that. We have a really big community, alumni community. We are especially recognized by United Nations as an NGO, and our mission is around transforming global health education. And I like to take a little bit of time to explain how we do that and what makes CFHI unique. So in our program, students travel to different sites and they engage with local health systems. And I'm using that word intentionally because it's important to recognize our role as learners when we travel abroad. So in our programs, we emphasize existing resources, existing projects, and students are placed in partner organizations, clinics, primary healthcare clinics, secondary level hospitals, tertiary level hospitals, depending on which site we're talking about. And they work side by side with local professionals. They're shadowing their day-to-day basis, learning about the health system from the inside. What does it look like? How is patient-doctor interactions? Even how health is shaped in a different place through a first row lens and having those really meaningful, impactful conversations. So we hold up local practitioners as experts in their environment. This sounds very obvious, and I always say this when I have to go through the statement because it is really bad that we have to clarify that is part of what makes us unique at CFHI. We have worked a lot in defining best practices and what is ethical engagement in global health. And part of that is around leadership and really understanding our role as we come to learn about a different culture, learn about different ways of practice. We focus on an asset-based approach. So that means that we like students and we incentivize students to come with a lens that not only focus on gaps, needs, what might not be going so well, what is better or worse or different in my country, but I can appreciate the things that are going well, that are innovative, that maybe even we can share back and put in practice in our own environment. It is very easy to, when you're in a new place, and you'll probably experience this even on vacation, it's really easy when you get to a new place where the roads are different. I mean, if you come here to Costa Rica, the first thing you'll notice in rainy season is that there's a lot of, the roads are a mess, there's a lot of landslides, there's a lot of flooding everywhere. So you can focus on those not so nice things about a country, or even what does that mean for the public sector, how it's structured. But we want also the students to realize that there's ongoing efforts on the ground that are valuable for our experience as personal and professional development. There is a place for a needs assessment, which is a really common practice in health professionals. But in a short-term experience or in the first weeks of your experience, that's not our focus. Our focus is to try to learn, understand, and explore as much as we can. And we do this, again, aligned with best practices of what is global health, ethical global health engagement, but also to not reinforce traditional power imbalances that the field of global health has a really dark past in this topic. So we want students to be agents of change in this and not reinforcing that colonialism or white savior approach to health. Going back to this slide, we practice virtual learning partnership. And this is a framework that is developed to analyze, review partnerships, especially looking at low-income countries with high-income countries and how the partnerships are set up. There's a big rubrics of how this is evaluated, and at CFHI, we're constantly reviewing that and making sure that all of our stakeholders in a global team, we're all speaking the same language when we say ethical engagement or fair trade. But just to give you some examples, this requires how is the leadership in the organization, how are the power imbalances, how are fees distributed, is everybody being compensated fairly for the work during the programs, how curriculum is built. The local teams are the one taking the lead in this, what we want students to learn while they're in country. I'm not going to talk more about that because I know you're eager to hear about what you're going to be doing in country and how that looks like. But if you're interested in learning more about best practices, ethical engagement, some of the lessons learned in this field, we have a tab in the website under publications, and there's a lot of resources there, a lot of materials that you can review later. So what we value in a participant is that alignment with our values, which means strong commitment with ethics and global health. There's going to be a really robust pre-departure training that you're going to get the opportunity to know what that means exactly from your own practice in the clinical rotations or in your engagement with the different stakeholders in Oaxaca. Flexibility, adaptability. We, of course, put together a schedule. Of course, there's plans in place, but plans change. And we need participants that are okay with that in a reasonable way and are able to adapt the way you're living probably, or your lifestyle, or even things that you're used to might be challenged while you're in a different context. And I'm talking really specific, simple examples like the food. Some people are more flexible about different type of food, delicious food in Oaxaca, by the way, than others. Maybe more flexible about the weather than others that could affect their experience. So we want participants that are open to that, acknowledge that that you come in with that you're going to approach those things with curiosity instead of resistance. New unfamiliar ideas, embrace those, learn from those, and humility, respect, and courtesy with all the people that you engage throughout the program. So those are really basic characteristics for a CFHI participant. Like you notice there, even though our program is focused on health, there's no requirements in this, and because students are not doing direct patient care at any moment, students are not doing a diagnosis or treatment of any patients. Your role is shadow local health professionals to learn from that. So that's why I'd like to go to the slide around what we look for in a participant, because that is a really common question. Julie already mentioned about the language requirement. That more fluent that you are, you can make the most of the experience, because it will help you interact and connect with more people. But if you have a foundational knowledge of Spanish, and with the goal of improving your language skills, this is also a good program for you. Plus, you have a few months to prepare and practice Spanish. So, how are our teams structured? This is the same for all sites. So we have a local coordinator, a medical director, and we have preceptors. Preceptors are the ones that are in the clinics and hospitals working on a daily basis with you. And they're going to show you around, and you're going to be learning from their work during the rotations. So this is the Oaxaca team. We have Dr. Marta and Sandra are our local coordinators. They are the ones that will oversee lodging, transportation, when we have planned excursions, cultural activities, any questions about daily things like transportation and how to get from point A to point B. Is it safe to do this? Yes or no? What would you recommend? These are going to be your main point of contact. You can think about them as cultural advisors also while you're there in Oaxaca. And Dr. Magali Chavez, that is our medical director. Dr. Magali oversees the clinical rotations. During the orientation session, you're going to receive a schedule where you're going to be placed each week. And she is also going to lead a seminar once a week, and it's going to be leading some reflection sessions also. So specifics about the program, I already mentioned this, and it is very important that we have a really robust pre-departure training. Just so you know, some of the things that includes are modules around logistics. You're gonna get all the specifics about like what to pack, what to expect when you first arrive to the airport, what to do in different circumstances, how to dress for clinical rotations, how is food like, some general aspects about culture, health and safety, visa requirement. All those things are going to be in your pre-departure modules. Then there's a course on ethics and global health, and also aligned with this, you complete the Global Ambassador for Patient Safety modules that will give you an overview of what that means, what is expected from you in the clinical setting, and what you should be doing, what you shouldn't be doing in that clinical setting. We share also our photography ethics commitment and what you should post, what you shouldn't post on your social media. You complete the Globe Smart and the Intercultural Effectiveness Scale. These are two really important tools that we partner with other organizations, Imperium Global COSET Group, to offer to our students that will help you map out a little bit where you are in terms of your interculturality and communication skills. And through this exercise, it's really helpful to set up goals for your experience in Oaxaca. These are all tools that are available in your pre-departure training, and it's self-guided with a lot of reflection questions and information that will help you prepare for the program. We include a mental health module, when to seek care, what you should be preparing in advance before going to the experience, all those things that, and helpful tips on how to deal with uncertainty, anxiety abroad. And we also hold a health and safety pre-departure orientation that it is focused on, well, there's a specific focus on COVID lately, but it also covers recommendations and guidelines, what to do and not to do while in Oaxaca, and what to do in case of an emergency. You're gonna see this health and safety recommendations highlighted in different moments of your pre-departure training. So let me go back to this one. After we're ready, we receive the live orientations, we're ready to, you know exactly what to pack, what to expect, then you travel. And the first thing you're gonna have is the orientation session with the local team. They're going to review again some of the guidelines, but they're also going to share some of the culture and key aspects for you to know, to navigate around the city. It's also an opportunity to meet your cohort if you haven't done it already. They'll talk about logistics and the specifics. As you know, you're staying with homestays for this program. So your homestay family is the one that takes you to the orientation place the first day. And these homestays have been working with CFHI for many, many, many years. Some from the beginning of the program, so almost 30 years or so. We have a really strict vetting process for our homestays. They're all centrally located. I'm going to talk about it. I'm advancing the presentation, but it's okay. They're all centrally located. You're good walking distance from the language school in most cases. And you're of course going to receive an individual bed, hot water in some of the homestays, most of them I'll say, but I'd like to handle to make sure that you don't have expectations around that. And 2 meals a day. So breakfast and lunch you're gonna have at your homestay. Dinner is not included, and this is intentional. So you have a little bit of flexibility to explore the city, because you're gonna notice that there's a lot of things to do in your free time, a lot of places to explore, and definitely going again to food. It's delicious. I'm a nutritionist by training, so I tend to judge the places according to their food and food culture in general. 5 to 6 hours or clinical rotations in the morning. Again, you're going to be placed in a different site each week, so you get to explore different tiers of care, primary healthcare, but also hospital-based medicine, and there's the option of rotating in NGOs if you prefer. Weekly lectures with Dr. Magali Chávez. This helps connect the dots between what you're seeing in the clinical setting and how the health system is shaped, how it's financed, how it's structured in Mexico in general. She will discuss some determinants of health. She's going to specify some of the main burden of disease or main priorities for the health system at this moment. So it is, like I said, a good opportunity to bring some of those content, more informational things to your clinical setting, to your clinical rotations. Language classes in the afternoon. These are organized by your Spanish level. So you're going to be placed in groups, small groups, according to your Spanish level. If someone is already bilingual, and doesn't feel like need Spanish lessons, there's the opportunity to learn Zapoteca, that is an indigenous language in Oaxaca. And 24/7 support from CFHI. I already mentioned this, so safe neighborhood, centrally located, 2 meals a day in your homestays. Staying with a homestay family, it's one of the most interesting part and valuable part of a cultural immersion, and those conversations and seeing the day-to-day of your family is going to be really important for your experience. And I want to talk a little bit about health and safety because it has always been important, but we've seen this year with reopening the programs after COVID, that is one of the main concerns for students and for their parents and their faculty and everybody involved. So I just want to go over really quickly what we do at CFHI to make sure that you feel supported and that you have a good safety net during your program. So like I said, we have the local medical director, the local coordinators, but also we have CFHI global medical director that helps coordinate during incident response. We have a 24/7 emergency line, and we have a risk assessment team that is constantly reviewing data for each country. So this is, again, your safety net during your program. Orientation sessions, 1 pre-departure and 1 upon arrival, that will cover all the information that you need to know for a meaningful experience. Accommodations, these are carefully vetted and monitored by our local team. Transportation for the excursions that we will include for this program. All transportation vehicles have been vetted by CFHI as well. We offer students a local cell phone number or cell phone if you want the cell phone itself. I'll be honest, lately students don't like our cell phones because these are the old ones. I think they're even flip phones some. The others are like really tiny phones, old phones that can only make calls and receive text messages, so no apps. But you'll have the opportunity, if you prefer, to receive one of those phones. The important thing here and why we do this is because we want to make sure that you have a way to always contact us and we have a way to always contact you. So this is part of our risk management infrastructure. During your clinical rotation, the preceptors are informed on your skill level. You're going to be wearing name tags that clearly say your education level, that you're coming as an observant for the program. So you're not put in a position to do anything that makes you uncomfortable or that to practice outside of your scope of work, which is a priority for CFHI, again, going back to the ethical engagement in global health. You're not going to be placed in any site where there are known COVID-19 patients either. We have emergency procedures that we review constantly with external consultants as well. You're going to be enrolled in insurance and again, the 24/7 emergency line. So, and I'm almost done with the presentation, so I can open up space for questions. But so what will your daily day look like? A normal day would be waking up in the morning, having breakfast with your home state family, then going to the clinical rotations, staying there for 4 to 6 hours, working with your preceptor. Usually there's more than one student per site. So you're gonna be with other, with other students of your cohort in the clinical rotation. You come back, have lunch at your homestay, and then you go to the language school. Like I said, that's usually walking distance. Once a week, you're gonna meet with Dr. Magali for the medical director seminar, and there's gonna be organized activities in the afternoon, some weeks, cooking class, dance class, things that will help you immerse yourself more in Oaxacan culture. And on the weekends, the Sundays are gonna be free, but Saturdays, some weeks we're organizing custom excursions for this group that are really pretty places, a nice place, but also have a value for your cultural immersion. And I can provide more details later on this. So through the program, you have a good balance between interacting, learning, having the experience and the privilege to be inside another health system and learning from that health system, but also having the cultural experience that will help you further a lot of your competencies for personal and professional development at the same time that you work on improving your Spanish skills. Then hopefully that's also a priority for you to participate in this program. Throughout the presentation, and with this I'll stop. I don't know if you noticed, but on the top right, this tagline has been there, let the world change you. And I like to take a second always at the end of my presentation so we don't just ignore it, because it speaks a lot of the program, speaks a lot of the organization and what to expect from it. And we wish that all participants, we hope that all participants have a transformative experience after they come back. And this, again, experience contributes for their future goals. This is my email in case you have any questions. I'm happy to set up individual meetings if you have follow-ups or any concerns that you want to discuss. So feel free to reach out, carolina@cfhi.org. So I'll stop here and open up space for questions or comments. Thank you, Lisandra and Melanie. It's nice to see people in Zoom.
Are you gonna stay with us, Carolina, or are you leaving?
No, I'm staying.
Okay, so if you have questions, she'll be here at the end too. Okay.
I'm staying for a few more minutes.
Okay, thank you so much, Catalina, for always giving a very thorough presentation and making us all want to go.
Yeah, I wish I could join the group also.
Julie, you need to, there is a question. Julie, you should share screen because the people are attending virtually.
I will, but there was another question. Do you want to say it?
How many people are selected to take part in this internship?
Sorry?
So this is, for this year, we are probably going to have a cohort around 15 students. And then maybe in the future, larger. But I think for this year, 15. That's correct, right, Carolina?
Yeah, correct. And you're also going to be joined by other CFHI participants, so you don't have to be worried if traveling solo or being alone in a new place is your concern, that's definitely not going to be the case. You're going to be with other participants. How good does your Spanish have to be, Anastasia? Well, an advanced beginner, I think it's a great definition, how Julie said at the beginning, that you're able to understand some phrases, simple phrases, and you're able to communicate also some simple sentences will be ideal. Going back to the schedule, you're going to be placed at clinical settings that really very likely 99% of the time the preceptors don't speak English. So it's helpful for you to have a basic understanding of the language.
A basic understanding and a willingness to learn, I think that's huge.
So we have three questions that are kind of related here. Is this available for graduate students in social work? Is this internship best for people pursuing the medical field? And are we able to choose what program we want to intern? So maybe a little more clarification on the different internship placements.
Yeah, sure. So this is set by the medical director on the first week, but there's a place in our application process and CFHI website when you start your application that talks about preferences. So there is a space for you to highlight if you go through the list of sites that are available for the Oaxaca site. So there's primary healthcare clinic, there's a government-run hospital, there's a secondary level hospital, there's an NGO that works in physiotherapy, there's also the opportunity to learn from traditional healers, that we will include that for all the cohorts. We have different primary healthcare clinics in Western City. So usually participants that have a specific focus or they want to explore a specific theme during the program use that space to say, I will prefer to work with in a place where I can explore pediatric, working with pediatric population, or no, I really want to see if we can incorporate something around mental health. That is possible, even though it is a group program, though you're traveling as a group. At the end, it starts being really tailored to your own preferences in terms of the rotations. Having said that, it is subject to what the local availability is at that moment, and Dr. Magali schedule and how she places students. What the benefit of being in a different place each week is that it gives you the option to explore and say, Dr. Magali, I want to go back to the other one that I really like. That is possible. So the local team does their best to try to accommodate your preferences.
Thank you. We have another question. Are we able to receive classes before the program if our Spanish level is low? Do you want to mention that?
Oh, yeah. For anyone who wants to practice Spanish, their medical Spanish in particular, the nursing department has a 6-week medical Spanish course that you can take that I believe starts at one date every month. And I would definitely recommend it. There was a student who went last summer, Kaylin, who did that and said that it was really helpful for her. So definitely something to consider.
And that's offered through Global Campus?
It's offered through Global Campus, yeah.
And what is this nursing class called?
It's called Medical Spanish. I don't know if maybe we can find it on, if you registered when you joined the Zoom in our follow-up, I can include that course.
Thank you.
Yeah, so that you can access it. You're welcome.
Did she answer about the social work question?
Mm-hmm.
Or she didn't?
Any other questions in here?
No, I think we've covered the
Excellent. Thank you very much, Catalina.
Are we going to be taking a Spanish language class when we're there? So how will we be, is it just one class or are there different classes, and how are we placed into those classes? If there are different level classes.
Did you hear that?
Yes, thank you for that question. It is very important when you learn a language to be placed with peers that are at the same level as you or similar level, So that is exactly what the Becari Language School that we partner with, it does. The first day you're gonna receive a language placement test, and you're gonna be then separated in different groups, maybe even different times during the afternoon. You're all receiving Spanish classes in the afternoon, but at different classrooms and with different teachers as well.
What if students are already fluent? How does that typically work for students who have a really high language ability?
Yeah, there's different options. We analyze that on a case-by-case basis. Some students decide to take Zapoteca. So if you want to learn an indigenous language, that is an opportunity, or others decide to complement with more cultural activities. So sometimes there's dance lessons or more time doing some of the other workshops that are available. So we can discuss that on a case-by-case basis, depending on your priorities and how you want to go around that.
Good questions.
We had another question come in. Is this internship done every year? Asking because I'm a first year and know that juniors, seniors receive priority. Yes.
Yes, the answer is yes. The whole idea is that we want to continue to build cohorts, maybe we'll even send 2 cohorts a year, who knows. But yes, so just stay tuned, stay in contact with Julie or anyone in the Global Education Office so that you can make sure that you receive our information. But yes, the answer is yes.
And who do we reach out to make an appointment for a case-by-case basis? Lisette, are you referring to the Spanish level question or just general questions about the program?
Someone's audio wasn't working, or like microphone. I don't know if that was that student.
Well, if the question is about the language component, after you submit your application, we can connect and see what options out there and how we can arrange that. This is also something that you can discuss directly with the local team if you prefer an upon arrival. That is okay. And again, whatever you feel is better, we can do. Either we coordinate in advance or you talk directly with the local team upon arrival. We're used to working with students that are bilingual, so it wouldn't be a new thing. It is just finding the best activities for you.
Right.
When is the Spanish class offered for like the medical one?
I actually just looked it up, and I think I'm on the right page, and it looks like they offer different cycles, and so they have one coming up, starting dates on November 16th, December 14th, January 18th, and February 15th. Yeah, and it says Spanish for medical professionals, and I just
6 weeks.
it looks like it's 6 weeks, but that's just the different. They offer multiple times. You can kind of select a time frame that works best for your schedule. But yeah, I think this is a 6 week. I'm still looking through the information. But we'll share this link. We'll share the link with everyone who's signed up for the info session.
Good.
And we can also put it on the brochure as
Yeah.
well.
That's a good idea, so that you can, anybody that looks at it, if someone's thinking, well, maybe my Spanish is not that great, just to know that that's a possibility will be good, right?
I agree.
You're going, yeah. Okay.
Any other questions?
When will we find out about the cost of the program?
So that's next.
Oh, okay.
Okay. But as far as what she presented already, if there's any questions on that. All right.
To answer, I'm sorry, go ahead.
I was just gonna say, one more question just came in. How much of a medical background do we need for the program?
Like, I'll go back to the same answer for Spanish in terms of the most important thing here is that you're interested in a health field and learning from about the health system and health in a different place. The students are not going to be doing direct patient care. Students are not going to be diagnosing, treating, or handling shots or needles during the program. That is actually prohibited during CFHI programs. So I will say more about the interest in learning than the background.
It's really good information. I think it opens it up to a lot more people, right? Yeah. Okay, very good.
Thank you.
Thank you, Carolina. Un aplauso.
Thank you.
Muchas gracias. Thank you so much. And feel free to reach out if other questions come up after. Thank you so much. Have a good rest of your afternoon.
Okay, you too.
Bye.
Bye.
It is now my pleasure to introduce one of our alumna from this past summer. Carly, thank you for coming.
Thank you.
As I know you probably want to hear what is it like actually from someone who's been there and who was in your shoes. Carly, could you tell us a little bit, just an overview of your experience and maybe some advice that you would have for people who are hoping to join the program?
Totally. I think that first off, it's definitely different because the professor's not there for the first 3 weeks. So that's definitely a bit of an adjustment. I think one main piece of advice I have is adaptability. The people are absolutely amazing. I am still in contact with my host family. I literally talk to my host brother on Instagram DMs almost every day. I talk to my host mom. She sent me a message over the weekend. She's like, "How are you? Hope school's going well." So the people are absolutely amazing. I totally agree with everything that Carolina was saying. She's also amazing, super helpful. The Bakari people are awesome. They really just listen to your needs. If something's not okay, you feel like you can vocalize that. Regarding my personal experience, just kind of some of the things that she touched on, the medical experience, medical background, you definitely don't have to have any medical experience. I would say the only thing is just be okay with seeing things, be okay with seeing blood, be okay with seeing people in really grave states. That was something I think that I necessarily wasn't 100% mentally prepared for. And just going into that, and especially when you go to the hospital and stuff like that, there are just people that are in really bad condition. And so it's a little bit jolting at first, especially being in a different country, but it's such a great learning opportunity. So just kind of having that, I think, as a precursor, if that's something that, you don't necessarily think is great for you, or you might not even want to go into that type of stuff, then maybe that's a little touch and go. But I think that was something I wasn't prepared for and wish maybe I knew beforehand. The doctors and the people that you work with are great. I would say the medical Spanish is really, really helpful. I didn't take the course beforehand. I know Kaylin, my one of the other alumna, did. And we just she helped me through it when I didn't know stuff. And then I also got a dictionary, a medical Spanish dictionary. That was really helpful because a lot of the times the doctors will be speaking to you in Spanish about these conditions. You'll have to read charts. So it's just when there's that huge barrier, you might not gain as much from the type of experience that maybe you would want to if you don't have that level of Spanish. I will say Google Translate is so awesome. And they're so nice about it. What's so awesome is you feel like you don't have to speak perfectly, or you can't pull out your Google Translate. There were multiple doctors that I worked with that were can we practice English? They were can we they're how do you say this in English? Asking me questions, and then we just want to learn, because they're I want to learn English so that I can open up and learn more and treat more patients. So it's a really great experience, kind of also feel needed from them in a way. Get to see a lot of cool procedures. I saw a lot of IUD insertions, stitching at the hospital. I'm trying to think of other things. We did go to a mental health place that was mostly for children and young adults, and we got to sit in on a therapy session, which was really, really cool and awesome. I really enjoyed that. I personally lived with Kaylin, so we each had our own room. We lived in the same house, and that was really awesome, that we were able to kind of go through that together and live in the same quarters, but also have an independent experience. And through the Bakari school with the Spanish classes, I know you asked about that a little bit. So you take that placement test. And it's kind of just like your average, like maybe you would take like in Spanish high school test, like conjugation, all of that fun stuff. And then you'll get split up. I was only in a class with Kaylin, so it's really nice it's kind of more like tutoring. I wouldn't even call it like classes. It's really like tutoring. And the teachers are amazing. I had 2 different teachers, so that was really cool to be able to like, I know Carolina probably talked about it, like just being able to talk differently when people talk differently, different accents, different way of teaching. I think that really helped. We did that, I think it was 2.5 hours, Monday through Friday after clinicals. And then that really helps build upon you being able to connect and talk with your family and be with them and like hang out with them. We played cards with them. We watched so many movies with my house mom. We listened to so much music. We'd like stay up late at night. She'd be like, let me just like show you this song. And like, I still like listen to all of them. And it was just such a great experience for me. I plan on going back to Oaxaca, hopefully this summer, maybe like within the next year, just because I loved it so much. And Professor Aguilar is like also amazing. I don't know if he's doing the program again, but he's also amazing as well.
Yeah, he's amazing. And Dr. Hernandez just walked in and he's a colleague.
Awesome.
So he'll be the professor.
Oh, cool. That's great.
So she's a graduate of the
From
program.
this last summer.
Yes. Yeah. Nice to meet you.
Okay, that's very helpful.
Does anyone have any questions for Carly?
I know it's a lot of information. I just say go in with an open mind, just be like super ready for anything and ready to learn, dive in. I had such a great experience just being like mentally like just expanding your mind, the cultural aspect of all of it. I really loved it.
And this QR code will bring you to Carly's website that she did as her final project for the program. Beautiful photos, descriptions of different excursions they did. So I definitely recommend checking it out. It's also linked on the program brochure.
I have a question about the class that we're supposed to take. I think it's PH 497 or 99. Can you talk more about that, please?
Sure, yeah. So students will, depending on if you're an undergrad or grad, will have a choice of 2 courses that you can take depending on how it will best fit into your academic career. So for undergrads, we have Public Health 497 and 499. That's the internship class and the research class for undergrads in public health. For students who are not in public health, I would recommend talking to your academic advisor to see if you can have it sub in for an elective or something like that. And then for graduate level students, we have Latin American Studies 750 and 795, which again, for any, say, public health master's students, definitely recommend talking to your advisor about just having that sub for a course. So we will, once you're accepted and you've confirmed your place in the program, ask you which course you would like to enroll in, and then we will have you enrolled. So you don't have to like go into your MySDSU or Global Campus or anything. We will automatically enroll you. Okay. We've been talking a lot about the brochure. Has everyone heard of Aztecs Abroad by any chance? Aztecs Abroad, if anyone doesn't know what that is our SDSU's main database of study abroad programs, and it's where you will apply to programs. So this specific program, the application will open January 16th, which I believe is the first day of class, maybe, for spring semester, and will close on February 15th. But it is rolling admissions, so I would recommend applying as soon as you can to guarantee that you will be able to get a spot. You will apply on the brochure page. You can see it's pretty small, sorry, but I have a little green arrow that is a tab on the brochure that's apply now. Currently, there is no blue button that says apply now, but once the application is open, there will be that big blue button. Click on apply now. There'll be a couple short answer questions, but nothing too intensive. There's no recommendation required or anything like that.
If you're not already on the inquiry list, make sure that you are, because we're going to email the inquiry list as soon as we open the application.
Right here, add your name to the inquiry list. I think many of you are, since we sent a reminder email about this to the inquiry list, but if not, definitely put your name on there so you can get the information. So the payment process is going to be in 3 parts. When you apply, there is a $500 deposit that goes towards the total cost of the program. And then there will be the rest of the fee, which is the on-the-ground aspects that Carolina talked about, the housing, the meals, transportation, that local cell phone, excursions, all of that split into 2 different payments that will be billed to your SDSU bill. And you'll have 20 days to pay after the initial bill date. Again, you're going to earn 3 units of resident credit through Global Campus Special Sessions. So if you've ever taken a winter class, it's just like that. It comes in special sessions, but it is resident credit. And the, again, deposit will go towards the total cost of the program. Right now, what we're having students do is there's going to be a link where you can click to make that $500 deposit, and you'll take a screenshot and then just upload it to your application. But if you're having any trouble, of course, you can reach out to us and we are more than happy to help. Right now, we don't have the exact cost of the program yet. So we're still working on the logistics of the excursions, everything that's going to be included, all of the cultural activities. We're hoping to have a cooking class, a dance class, a trip to the market, hearing about Oaxacan chocolate and all of those really exciting cultural aspects of Oaxaca. So once that is totally finalized, we will put that on the brochure, but I really want to highlight all of the scholarship and funding opportunities that exist for this program. Like Dr. Alfaro said earlier, there is a pool of money through associated students that is going to be specific to this program. So because this is such an important initiative by the president and by International Affairs, we want to help make it accessible to students. So we will also be giving information to those students that there will be funding available. There's also a lot of other both SDSU specific scholarships and external scholarships. So has anyone heard of Aztec scholarships through financial aid and financial aid services? No? So there is a question on that when you're going to fill out your Aztec scholarships application. There's a little box that says, do you plan to study abroad? Make sure you check that, because then you'll be automatically matched with all study abroad scholarships that pertain, that you would be eligible for. And for those who haven't used the Aztec scholarships database yet, how it works is you fill out a survey and you get automatically matched to all scholarships you're eligible for, and you write a couple essays, but short ones, and then the application is sent to all of the different scholarships. You don't have to apply to a million different ones. So definitely make sure that you are applying through Aztec scholarships. And also on Aztecs Abroad, so our study abroad database, we have an area about financial aid and scholarship opportunities, and I definitely recommend checking it out. For example, if you are a student who receives a Pell Grant, we recommend the Benjamin Gilman Scholarship that can be upwards of $5,000. And as a university, we are a top producer of Gilman Scholars. So very much recommend looking at that if you are Pell eligible. Fund for Education Abroad is another external scholarship. And there are many more listed on our Aztecs Abroad financial scholarship page. And he snuck in. It is my pleasure to now introduce the faculty member for this summer, Dr. Roberto Hernandez. If you would like to, I don't know where you'd like to be.
You need me to come somewhere because of the
Well,
Zoom?
wherever
We
you
have
want.
14 on screen.
Oh, okay.
Maybe right there. Sit right
Yeah,
there.
and
And then this is a book that was written by Dr. Hernandez. That's really an amazing book. So just so you know, he's a top scholar, in addition to a lot of other things.
Well, first of all, hello. So I'm Roberto Hernandez, faculty in Chicano Studies. And as you see on my bio here, a lot of my work is focused on both racial colonial violence and border violence in particular. But I also do other work in terms of the impacts of U.S. policy and foreign policy on indigenous communities in Mexico. So part of the idea of the course is to kind of give some of the socioeconomic context to some of the practical internship work that you'll be doing, right? So looking at how, for example, changes since NAFTA have created situations of displacement for people that from traditional staple foods to jobs to relying more on processed marketed food, and how then this has had impacts on health health outcomes, right? And also in terms of migrant communities coming here, what has been talked about as a Latino health paradox. So looking at how on the one hand, although there's high levels of obesity, there's still other markers in health outcomes that you would think might be bad, but are actually good. But this arguably, in terms of the scholarship, has to do with the history of traditional diets. And so I'll be trying to kind of put into context some of the more practical type of approach that you'll be having through your internships, and then as well as some of the cultural aspects of Oaxaca and surrounding communities. Yeah, I'll say that much. And my work is very varied, a lot of different areas, and but definitely in terms of Mexico, I have a long history of working with different indigenous communities, and at various levels, more practical work in the communities, but also nationally with the National Indigenous Congress. So there's connections of some Minisa and other communities there in Oaxaca that, depending on how the course is structured, I'll also be looking to try to bring in some of those local traditional practitioners and so on.
Awesome. Excellent. Thank you so much.
Any questions?
Yeah, any questions from your other? Back over here.
I think that was my last slide. I don't even know if I put a question slide. I didn't, but does anyone have any questions?
Stay here. Yeah, so this is a time where it's really important because we want you to go. And we are all here. Okay, we have 1, 2, 3, 4, 5, 6 people that are here ready to work with you to make it happen. If you feel that it's the right program for you. We always want to know, like, what is it that would stop you from going? Obviously you're interested, right? And so whatever it may be that you would see as a possible barrier, we want to make sure that we can say, okay, we can help you there, or this is what we could do, guide you.
How much did the program cost last year? Like ballpark, that way you can kind of know.
I think it was about 5,000 last year for the 6 weeks.
Yeah.
And there wasn't subsidy last year.
Yeah, there wasn't subsidy. So this year, the president really wants our students to have this experience. So she's worked with AAS to make sure that we have
That's awesome.
funds available. Yeah.
Sorry. I will say, like, on top of the program fees, like, it wasn't a ton of money that you have to necessarily bring to to supplement that, if that makes sense. Like for extra food, or like a lot of the money that I spent was on stuff that I wanted to buy, experiences. And I know like you guys were talking about excursions, like that was the most of it. Like all of like the basic necessities was like all covered within that like program fee.
Plus it's not very expensive to
Exactly.
eat or to buy clothes. I mean, you can get away with some delicious food at very low cost.
Absolutely.
But you're going to get 2 meals every day with your family.
Or more.
I
mean, in the morning, she would make us like a sandwich, a donut, bowl of fruit, a quesadilla. I'm like, I can't eat it all. And she'd like pack it up for me, and I'd bring it like in my backpack. Like they feed you well. Because I'm a vegetarian, so I was worried about the food going into it. And very accommodating, would ask you like what you like. And if you didn't like something, there was always like a second option. So I know that was something that I was worried about. The food was amazing.
So they cook for you?
Yeah. So yeah, whether or not it could be the mom, the grandma, the grandpa, aunt, uncle, someone will cook for you. But you're able to like go and like buy food, buy snacks, all of that type of stuff. But they'll cook your main meals for you.
Pretty nice, huh?
Yeah, very nice.
We have a few more questions in the chat. So, is this program open to PhD students?
Why not? They're
I don't see
graduate-
why not.
Yeah.
Yeah.
They would take the graduate level
Yeah.
course, so as long as that was okay with them, but
And what are some of the things you look for when choosing applicants for this program?
Well, the admissions are going to be rolling. So if you meet the criteria, you have like a little background in biology and human anatomy, and we do have a short essay question basically asking why you want to do this program. And if you think about what Catalina said, that, this is an ethical health program, knowing that you're not going to be delivering babies or anything like that, you're really going to observe, and you are hoping to have this program change you rather than thinking you're going to go in there and change everything and show the local professionals everything that's wrong.
I think she called it the white savior.
Yeah.
The white savior syndrome.
Exactly. Just
That would keep you from getting into the.
right. Being open and ready to learn. But again, I would say it is rolling admission. So apply early, apply right on January 16th.
Yeah, I like what she said. She says, why are you interested, right? Why are you interested in this program? And if you can make a good case for why this would be interesting, maybe it's not really directly related to your field. That's what I'm thinking. But it could be, it could actually change you, and say like, you know what, right?
Absolutely.
So, and like you said, as long as you're not afraid of blood or seeing, difficult situations in the medical field, then I think it would be good. So rolling applications, I'm going to say this, do not disqualify yourself. Just if you are interested, go for it. And then we'll work with you and see if it's a good fit for you.
Yeah, and I'll just add, right, this is why some of the brochure materials says public health, social work, pre-med, right? So there's a wide range of different tracks that you might be pursuing in your own respective studies and career, that even if it's just indirectly or tangentially related, and that this will be a benefit for what your career goals are, then that's what makes you eligible.
Any more questions?
I kind of wanted to gauge who is kind of on the fence because of a cost kind of concern. Yeah. I tell this to all students, but I really recommend, you have a window now between now and when the application opens. Research every single scholarship opportunity out there. Julie mentioned the links, like we provide a lot of options as far as external funding opportunities, because now is a time to prepare your application and your personal statement, and oftentimes they all ask the same type of questions. So you want to write one really strong personal statement essay, and then you can apply it to numerous scholarship opportunities. I had a student who knew she wanted to go abroad, and cost was entirely a factor of whether she would be able to, but she planned far in advance, and she kind of assumed that she would get like no scholarship, so she just started applying to a lot of them. And she had one really strong kind of personal statement essay that she was working from, and she said they hardly made edits to it. It was often very similar, so she could take whole sections of the essay and apply it to multiple. And she ended up applying to like 10 different scholarships, and then she got all 10 scholarships.
She had more money than she needed.
She had more money than she needed, and then she went traveling afterward, because these scholarships don't talk to each other. I mean, especially if they're external funders. So you have to put in the time, but you could really, make or earn, think about what you might make in an hourly job here. And if you ended up getting $6,000 or $7,000 of scholarship funds because you applied to as many opportunities as possible, I mean, it's a good use of your time to use this window now when all those scholarship opportunities are open. But they do tend to close early when we get into that spring semester. So using this time now, also crowdsourcing, like maybe this is what you want to do. And so you kind of create like a little GoFundMe, and you tell all your family members, like, I don't want Christmas presents this year or holiday gifts this year. Like, this opportunity to Oaxaca is what is really important to me. And even $20 here, $30 here from family members and friends, that can really make a huge difference. So use this length of time that you would have available to work towards that goal of the program. And we're gonna definitely have our own scholarships for this program, but there's ways that you can bridge that gap. And I've worked with students who found a way to have none of it come out of their pockets or from personal loans or anything like that, because they just use the time now to prepare for it.
Exactly. So if you want to go, start planning right now. And we have advisors that are here to help you. If you run into any problems or need some more guidance or just want to go over this again, that's okay. You're also all welcome to come to this room and work together and help each other. I know I used to do that a lot with when I was working with the credential students, and it was like, this is very time consuming. It's okay, we're gonna have an application party. Everybody come and we're gonna all do it together and you can help each other out. So that's also a possibility. You know, you might wanna maybe pull something together like that. Because you have to start early. You have to start early. This is a program that you have to start planning way ahead of time, right?
Yeah.
She's like, okay.
I do agree.
So what else? Okay, so take into account that if you do everything that was explained to you, you're gonna have the money, okay? And we're gonna help you with that. So what else would be a possible barrier?
The language, because I don't know any Spanish at all. So it's like, oh God, I gotta start learning now.
At all?
At all.
Okay. Well, you have a desire to learn. And you can take that class, you can take other courses. We have a very good Spanish department. Maybe just doing like the conversational Spanish. Because I don't think you're gonna have exams in Spanish or anything like that. You know,
It's meant to help them, the language.
yeah, the whole idea is to help.
Oh yeah, there's no test.
If you come with an open mind and you start practicing right now, my previous work was in preparing bilingual teachers, and I would have a lot of students that would come in and go like, I really want to be a bilingual teacher, but I don't speak Spanish. It's like, okay, but they wanted it so badly that we say, okay, you know what? That's the most important thing. Are you willing to learn? And so then you just kind of find a way to start learning, like every opportunity that you get, speak Spanish, listen to Spanish radio, watch a Spanish novela, read in Spanish. You know, just force yourself to, you know, be around, and it will get you there. It really will.
I use Duolingo also.
That's another one.
Yeah. Just to like every 10-15 minutes every night before like I was like going to bed, I would just do some questions. But yeah, I agree. Also like Spanish music, I think really
Spanish music, yeah.
it really helps.
So what's like the basic level of Spanish that you need to know, so that way I kind of have like a gauge, like, oh, I need to
Well, I think that if you can begin to, si yo empiezo a hablar español ahorita con ustedes, ¿me puedes entender un poquito? ¿Puedes entender el contexto? So that you can at least pick up some of the context, some of the words, so you can take advantage of what's being taught. But if everything is just kind of, you know, going like this, then probably it'll be difficult. But you have time. You have time and you have the desire. You're here. I don't know. Does anybody have any other encouraging words?
Hi, my name is Letty. I'm the International Internships Advisor. So you can always book an appointment with me if you want to go over absolutely any of this. I just put my name in the chat. Feel free to email me and I'm happy to meet with you.
Thank you, Letty.
Yeah, just on the language, I would just say, I mean, you know, you're in San Diego, so the context is ripe for you to be able to really take a deep dive and you know, at least get to some basic conversational, and by the time of next summer, you know, at least basic into intermediary, so that you can in Spanish we would say, you know, defenderte, right? You could defend yourself when spoken in Spanish, so you know how to get around at least in town or whatnot, basic things like that.
You can do it. Okay, so money, language, what else? The desire is there, you're here, right?
I'm curious for, in terms of your existing kind of majors or the direction you're taking, like, do you all see this as fitting or supporting, complementing that, or?
Have any of you studied abroad before? So it would be a first time? That's
Oaxaca's a
wonderful.
great place to just have that first experience. I went for the first time about 2 months ago, and I like cannot wait to go back. It has, especially in the part where you'll live and be working, it has this kind of slightly small town feel where you feel very comfortable walking around. Everything you need is within your reach, but it also is a big city. And then there's like the geography around that area is absolutely beautiful. Like there's wonderful things to see, and then because this is a cohort program, you get to embark upon that type of first study abroad experience as a group rather than going completely off by your own. So I think this would be a great program for someone who's hasn't traveled or done a study abroad program yet, because the location works really well for that. The people are absolutely like incredible, like super, super friendly and kind and very welcoming. So.
Lysandra, are you still on there?
Hi. Yes.
Lysandra? Okay, good. Lysandra is a doctoral student and she went last year through an education. It wasn't this program, but it was your first time in Oaxaca. Maybe you can share a little bit about your experience and how it helped you.
Yeah, so I went to Oaxaca this past May. And so we stayed among other doctoral students in the College of Education program. And it was a really great experience. I mean, I feel that our days were, I don't know how similar or different these programs are going to be, but I know the cultural workshops that we got to embark in and go to different like cultural immersion experiences really did even just me coming, my background is I'm Latina and I know Spanish, and I kind of went into this thinking like, oh, I kind of know what to expect, so I thought, but I feel like once I left the program, I was like, wow, I feel like I learned so much more than as if I was going to a different country that was different than my cultural background. And so just learning, it was just even just, I think just a very exciting opportunity, and I'm grateful that I was able to do that. So I highly recommend that it's just very eye-opening and transformative, and you learn a lot about the indigenous cultures there in Mexico. And so yeah, I think it's just, I highly recommend, with regardless of any program or different or similar of how it is, I think just being there in Oaxaca in that space with those people, with the indigenous peoples, just truly transformative. So
Thank you, Lysandra. Yeah. So yes, it's a great opportunity.
Beyond great, I think.
Beyond great, yeah, it's an amazing opportunity.
Yeah, and I can share about like more like the cohort type of thing. Along with the students like at STSU that I was with, there were only two others besides myself. There were also students there from Stanford. There was like 15 of them that were also at the Bakari School of Language. There were also other people, other students, people, just like other people that had just graduated from college that were also there. So you really I never felt alone, and there was always people to do stuff with and people to talk to, and you would see the same people all around town, like, you know, I just feel like it's like like you said, like that small town, like town type of feel, even though you are in like a city, you really are able to navigate it really well. I think that's also a really, really great aspect as well.
Thank you so much. Do any of you have like parents that would be concerned about you? I'm asking this question because my parents were like, oh, no, está muy lejos, that's too far away, you can't go. Is that something that, yeah, okay. We can talk to your parents. I can talk to your parents, you know, because first of all, maybe people think about safety, right? Because you hear of all these things in Mexico. We have someone that works with us that's a health, safety, and travel risk manager, you know, COVID. So we will not send you anywhere if you don't pass, you know, this criteria that it's safe for you. And Oaxaca is very safe. So, you know, parents might be concerned about that, or you might be concerned about that. So we could also help to do that. I know when we went to the Imperial Valley, we were hoping to meet with parents because we know that a lot, the smaller the town you come from, the more, kind of the nurturing and they're like, no, especially you're in a little small town. So we were ready to speak with parents. So we could do that too. I mean, if that would help you, he's totally happy to talk with your parents. And I know Dr. Hernandez would be a great person to speak with your parents as well. Just to make them feel safe, right? And to let them know you're going to be with the family, you're going to be taken care of. And the families that they select, I think Carolina talked about this, is their families that they've worked with for over 30 years. So because they get good reviews, like your family, right?
Absolutely.
That you would say, oh yes, use that family again. Because I don't know if you did an evaluation, but sometimes you say like, how was your stay?
Yeah.
And if it's high marks, then we'll use that family again. And if someone says, oh no, they were rude or whatever, we're not going to use you anymore. So all of this is what CFHI does for us. So that's like their business. And ours is more, just getting you ready. And then Dr. Hernandez being the person that's going to take care of you, basically,
Yeah, and even though this will be my first time doing a program like this in Oaxaca, like I have done different types of kind of study abroad and related programs in Spain and Mexico City and Brazil over the last 10 years. So I have a lot of flexibility and know how to move around in different spaces.
Yeah, that's really important when you know that you can trust, the leader that will be with you.
I know you said there was like other schools. Is it 15 mixed with the other schools or 15 from here?
From here.
From here.
So I mean, that's the goal, is that we are aiming to have 15 from San Diego State. If we have more, we can work for that. But the first 15, those are the ones that we are going to, and you are the first ones right now. So for us, we want to take care of you. You made it. You made it here. You made it happen for you, and we want to work with you.
And the 15 students that are SDSU students, those are the ones that will work with Dr. Hernandez. Others, you'll have a chance to meet students from all over the country and maybe even outside of, the United States, because they're also taking part in CFHI's programs. But CFHI has made a custom program just for this group. So we're building in, like all those cultural activities that Julie mentioned, along with the placements and along with the language course, as well as the actual classroom and teaching time that you'll have with Dr. Hernandez. And he may or may not be there for the whole time. We're kind of still working out the schedule, but he's also going to be there as a resource for you, even if he's not physically there, you can be in contact with him as well.
Mm-hmm.
Excellent. So I know that we're a little bit over the hour time, so I know that some of you might have classes or we just want to be respectful of your time. We'll be here for a little bit if you want to stick around and ask more questions or just chat. But I'm going to go ahead and stop this recording. Thank you so much. You are the troopers, the 6 of you that stayed this whole time. So have a good day, and we'll send out the slides and the recordings soon. Okay, bye.
Okay, so those of you that are here, please take some goodies. You can take them to your next class. Okay. You can take them to your friend. But please, we bought that for you, so please take advantage. Okay, my office is here. Let me give you my card.
Thank you so much.
You're welcome. Thank you.
And if any of you guys want any of my contact info, feel free to ask me. If you even have a question like 5 months from now, feel free to ask me. I had the best time going to Oaxaca, and with the experience, I would be happy to talk to any of you guys.
Yeah.